Hey, my name is Dr. Augustine. Today, Nathan is here because he has hip pain, right hip pain, and we always like to find the source or cause of problems and work at that level so that problems will heal and resolve and go away. So, we wanted to talk to Nathan about this, and we discovered a few things. First and foremost, if you look at this picture here, the sciatic nerve comes from the lower back, the lower three nerve roots in his back, and that's what provides pain into the hip because it goes down each leg. Specifically for hip pain, it's your fifth lumbar. And if you look at this picture here, here's the sciatic nerve coming right through the musculature through a person's rear end beneath a muscle called piriformis. And the classic thing is you have branches that come out and supply that hip because people will swear up and down that the pain, the problem is in the hip, but it's not. It's really coming from the lower back. So we took pictures, x-rays on Nathan, and we discovered that Nathan's spine is very rotated towards the right side. All of these vertebrae are torqued closer to this right edge than to this left edge here. Second picture from the side view, this is called lateral view here. We discovered that Nathan has some degenerative discs in his lower spine, and that also tends to decrease the height of those discs. It decreases the holes where the nerves exit on both sides. Then rotate his spine, in this case is rotated to one side, that's going to give him the pain into his hip. Now we're going to take Nathan out and we're going to adjust him, plus we're going to give him some preparatory exercises. They're going to prepare him for ultimately corrective exercises so he can heal and resolve this problem. So we just looked at Nathan's x-rays and we discovered that the cause of Nathan's hip pain is not coming from his hip, it's actually coming from his lower back. We determined also how to adjust Nathan from those x-rays. So we're going to bring Nathan in and we're going to first and foremost have you lay on your side facing that way. Just lay straight down on your side. So this adjustment is for his sacrum. It's actually to open up his sacrum and take pressure off the nerve roots and the discs in his lower back. So if you lay it completely on your side, this knee's going to be bent. There, the shoulder here. Good. Now we'll roll you this way. It's right. It's going to come down this way. Good. Now let's put you on the other side. Now this side's specific for his lumbar spine. It might look the same, but I'll show you what's different. This one back, that, this one straight. Lumbar spine, L5 is what refers pain to his hip. So in this case, we're going to rotate his lumbars around this way. So it's going to be right in here. Good. All right, come on up.
Cool.
How'd that feel?
Feels good?
Good.
Yeah.
So the next thing, we're going to actually show Nathan some exercises that are going to help prepare him for the corrective exercise so he can fix and resolve this problem. So it goes away and stays away. These are preparatory. These also make him feel good and probably keep the pain and symptoms away pretty well. So now we're going to show Nathan 3 exercises that are going to help prepare him for corrective spinal exercises to ultimately resolve this lower back and sciatic problem and hip pain. So first thing, we're going to have him lay down on his back. I'll show you how to do this. We're going to have him lay on his back, and he needs to flop his knees towards his right side. In this case, he's going to lay flat like this, and then I'm going to have him just rotate his knees only towards the right side. And he's going to do this 15 to 20 times, 2 to 3 times a day. So the second exercise is having Nathan seated. Then he's going to be leaning forward, knees wide apart, reaching towards the floor, taking 3 deep breaths in and out. As he blows out, goes a little deeper, stays there, another deep breath in, blow it out again, a little deeper, one more time, a little deeper. And he comes up like this, and this decompresses his nerve roots, take pressure off the disc, and also stretches out some really tight muscle spasms that he'll have into his lower back. He had right hip pain, so here's the other thing, is as he's doing this, he can also lean more towards his left side so that he'll more so stretch the right side. Okay? Exercise number 3. Nathan's going to cross his leg, just his right leg over his left, as flat as he can go. The more of a sciatic problem or hip pain he has, the tighter this will be and the more difficult this will be. So you want to bring this knee as flat as you can bring it, and then he wants to lean his chest towards his foot. And as he pulls in here and holds this, takes some deep breaths and blows out, it's going to feel a really tight, painful stretch in his right hip and rear end, right where that pain is at. What this is doing, this is stretching his, basically the piriformis muscle that sits right over the top of his sciatic nerve. Stretching this out right here will feel tremendous relief. He'll feel so much better. So now moving forward, we're going to have Nathan do several things. We're going to have him take a supplement that's called Ligaplex 2 and or Ligaplex 1, because Ligaplex 2 is for muscle and tendon issues. It provides the raw materials to repair your tissues, but also Ligaplex 1 is more for disc and cartilage tissue. So we want to support him in that side of things. We're also going to recommend the ketogenic diet because it's very anti-inflammatory. And also, ASBE is ultimately what we want to get to. ASBE stands for Applied Spinal Biomechanical Engineering. This is a way that we're going to design corrective exercises so that his spine will stay where I'm putting it. The adjustment that we do puts his spine into place. Then these exercises that we design will keep them there, and his sciatic and hip pain problem is solved. So if you have any questions about what we talked about today, you can leave a comment or you can email me at draugustine@gmail.com. I'm on social media, YouTube, Facebook, TikTok, and Instagram. Thanks so much for watching my video. Have a great day.